Hello and welcome to the CSR Journal. Today we have two very esteemed guests with us, Dr. Neerja Birla, noted educationist and mental health activist, and Advaitesha Birla, who is the daughter of noted Indian industrialist Sri Kumar Mangalam Birla and Dr. Neerja Birla. Hello, ma'am. Hi, Advaitesha. Welcome to the CSR Journal. Today we have gathered here at the launch of Ujaas Menstrual Health Express, which is an initiative of Advaitesha, which is running a social enterprise for menstrual health and hygiene across India. We would like to hear from Advaitesha first about Ujaas and Ujaas Express.
So Ujaas was launched in 2021 with the mission of educating people about menstrual health and creating awareness, distributing sanitary napkins, so making products more accessible to those who don't have access to it, and more affordable as well, and identifying sustainable measures of intervention. So we work at the grassroots level and we conduct a lot of workshops with different beneficiaries, not only girls but boys, parents, communities, teachers, teacher training. And our aim is to provide a holistic solution so that girls have a support system which they can rely back on and which they can seek support from.
So, what kind of facilities, what kind of support staff will the Express be equipped with?
So we have our team traveling with the van. Our trainers are there, and wherever the van stops, we also have local NGO partners who we are going to train and who then on our behalf are going to take workshops. So it's a whole team that's worked very, very hard for this, and without them, it would really not be possible.
So, one van and the entire nation you have to cater to. So, what are your plans? Like, how will it move and how can it cover the entire country?
Of course, it is a very big, it's a big task, but we have a great plan in place and a great team. So it's over about 3 months the van is going to travel, but the campaign will be for the entire year. And it relies a lot on our NGO partners, and the work is going to happen simultaneously with the van traveling. So I think that's our goal, and that's how we're going to be able to achieve it.
So, one question for Neerja ma'am. Ma'am, Advaitesha, at such a young age, she has taken up this kind of a subject. Like, I was probably thinking kids of her age will think about doing something with AI or something of that level. But menstrual hygiene, which is, of course, the need of the hour, we all understand. So, what was the encouragement, the inspiration? What was your role, ma'am?
So I think she would probably be the right person to answer that. But I think menstrual health is something that she's always been passionate about. And from a very young age, she wanted to do something to give back. In fact, when she was very small, she may have been all of 4 or 5, and she's very good at art. So she had done an art exhibition. She'd done an exhibition of different art products. And she'd actually called people over and she'd done a small exhibition. And the proceeds of the sales we had given to an NGO. So she's always had that altruistic bent of mind. She's always wanted to give back. She's always had that. She's always been very empathetic. So even a couple of years ago, she mentioned that she wants to do something, on a larger scale and be able to give back. And I think menstrual health is what came to her very naturally, and because she does feel passionate and she feels quite strongly about empowerment and equality, and this is something that really addresses both. So that's how she took it up.
Advaitesha, talking about girl-child empowerment, especially in India, we all know this that girls are made to drop out of schools once they start menstruating, and not only superstitions and stigmas are to be blamed, but also lack of proper menstrual infrastructure in the school, which ma'am was even mentioning, the periods poverty. How does Ujaas address this issue?
So I think the first thing is education and awareness. I think, and that's at the core of what we do. I think creating awareness is the first step in order to see change. And I think that's where our holistic approach comes in when we're even talking to community members, because it's very important to have everyone's buy-in to be able to actually, make a difference. So I think awareness is very, very important. And I think with that, of course, there are of course infrastructure changes that are necessary. I think that's something that in the future, uh, probably look at that in the future.
So, and talking about menstruation again, the biggest problem in India that we have, even in the rural areas specifically more, and even in urban slums, you can say that the stigmas, the superstitions, we all know you cannot enter the kitchen, you cannot enter the temple, and girls are considered dirty during the menstruation time. So, how do you feel that this mindset needs to be changed and the role to be played by Ujaas in this?
Absolutely, I think it does need to change, and I think that's why we're here, and that's why we started something like this. Having said that, I think that it's something that will take time to change. It's not an overnight change. I think change it will be a generational change that needs to come about. I think when we educate and empower young girls, and they start thinking differently, that's when I think when they grow up and they'll educate their and bring their children up differently, and that's how the change will happen.
Absolutely. I would to add to what you just said, ma'am. I was reading an interview of yours where you were saying ki when in my growing up years, the scene around menstruation was so very different from what it is today. I believe 50, 60 years from now on, that generation will not have to face probably we have faced, and many women, girls in the rural areas, they're facing even today.
Hmm.
And
But not only, I think, not only in rural, I think
hmm,
even in urban, and
even
we
in
see it even in well educated, so-called, very well aware, and very exposed families and women as well. I think a lot of times people just carry on with myths and stigmas just because it is just it's tradition in a sense. People don't want to even think against it. So that's what we need to do. We need to educate people and tell them that there is another side that exists. We don't have to blindly follow traditions just because they were done 20 years ago.
exactly.
We really need to make them think and ignite that questioning mind. That do we really need to follow certain traditions? You know. So I think that kind of change really needs to happen even at an urban level.
Absolutely, absolutely. I agree with you on that. And talking about mental health, ma'am, I have been following some of the work Mpower has been doing and notable initiatives you have been taking, and especially for mental health in India. And we know how difficult, I will use this word deliberately, how difficult is the battle against mental health for those who are facing it. Ma'am, mental health in India comes with a fair share of stigmas and labeling. Like किसी को depression है, we call that madness. वो तो पागल है. That's the first thing. And I will not never say that this happens in rural areas, even in urban areas. We do this. Ma'am, how with Empower, how are you addressing to change this?
So very similar to what we are doing at Ujaas, right? To bring about that paradigm shift, because it is a mindset shift, you have to first create awareness. Because very often one is not even aware of what you're going through. You just feel it's normal to be feeling sometimes under the weather, not realizing that it would actually be an illness. Very similar to at Ujaas also, right? A lot of times women are not even aware that this is not the way it is really supposed to be. So I think at the first level, I think creating that awareness is very important, which is what we're doing at Empower as well. And then from there, we're also doing a lot of outreach, educating more and more people about it, increasing mental health literacy in different communities, and then providing clinical care wherever we can do it. So, we're trying to create that entire full circle of starting from creating awareness to then providing clinical care to actually, encouraging help-seeking behavior so that people can actually seek help and with that intervention actually feel better, which is very similar to a cycle at Ujaas as well, right? Where we're creating the awareness, then distributing the pads and trying to make them sustainable. So I think that's kind of the basic overarching theme that we have across, that from creating awareness to actually providing solutions and then make it sustainable.
Absolutely. And ma'am, do you think that in India we need policies at the government level or anything that can contribute to bringing about this change? I'm asking you this question because you have collaborated with Mumbai Police, with the government of Maharashtra, the Samvedana initiative, and all of that. So, any policy changes that might help?
Most certainly, I mean, policy changes will definitely help, but at the end of the day, everybody, each stakeholder, and everybody has to do their own bit, because there are a lot of policies and a lot of sort of programs at the rural district level as well, for mental health also, for menstrual health also,
Absolutely.
right? The government has put together plans and programs, but they're not being executed to the extent that they should be. So I think creating the policy is one aspect of it, but actually the implementation of it is actually as important. So they both have to go hand in hand.
Absolutely. And ma'am, we at the CSR Journal, we deal with corporate social responsibility. And ma'am, we have seen that while doing research on the areas where corporate social responsibility has been focusing in India, we have seen that a fair share of attention of CSR focus goes to healthcare, education, empowerment. We can understand. But what about animal welfare? What about mental health? What about menstrual hygiene?
So animal welfare. So we both are animal lovers actually, and I do feel strongly that I wish we could do more in that space. But I also understand that a lot of people don't relate to animals, for example, and then there's a scarcity of resources. So I guess the thinking is probably that if there is a limited resources, why not put it towards something to do with humans first and then animals. I mean, I don't espouse for it necessarily, but I'm just trying to think that maybe that's how people think.
Yeah.
But mental health and menstrual health, most certainly. I mean, mental health, I think, in fact, mental health is right at the bottom of the ladder. I think because it is not, you can't see it, it's not tangible. Results can't be seen, impact can't be seen. It's a very longitudinal kind of a map. And, I think a lot of times to grant CSR, companies want to see the actual impact of it. They want to see tangible results. And as far as mental health is concerned, it's very difficult to give you, exact numbers and tangible results. And also, you normally see results over a long period of time. And you cannot see a result in a month. I mean, it's not a quick fix. And I think that is probably one of the reasons why companies do not grant CSR so easily for mental health. And I think for menstrual health, I would say is that because it is also so taboo and it is so stigmatized, people don't very easily go into areas which are stigmatized. It just is human nature. And I think menstrual health probably falls under that gamut where you can see results. I mean, you've given X number of pads and you've helped so many beneficiaries. So it is a direct impact. But again, because we're looking at a behavioral change, because when you're trying to create menstrual health awareness, you're also wanting to see behavioral change. And to monitor behavioral change actually takes time.
Advaitesha, one question I have for you, that you are a youngster, young blood, and you've taken up this kind of an initiative, menstrual health. So, if I ask you that, what would you may ask the corporates to urge them to, donate more CSR funds? That okay, please come and donate for menstrual health. How would you do the task of approaching corporates given a chance?
I think firstly we need to talk more about it. I think we need to have more open conversations. I think people, there's a lot of shame associated with talking about it. So I think creating that buzz around it is very important. I think even for corporates, I think if more people start talking about it, I think that's the first step. And then of course I think approaching them with a good plan, and I think like Mum said, they like to see results and quantifiable results. And I think with menstrual health, and the work we do, there is a direct impact. As in, you can say these are the number of sanitary napkins we've distributed, or the number of trainings we've conducted. So I think talking about it more, having more open conversations.
Ma'am, recently paid menstrual leave was in the discussion once again, with some women opting for it, some opting against it. I would like to hear your take on the same.
So I think it's very important we give it over here at Avid. I mean, and of course at Avid, more than 80% are women. So it's most natural to give a paid leave for menstrual health. I mean, a lot of women do go through a lot of discomfort, and I think it's only fair to do that.
And talking about the Aditya Birla Education Trust, ma'am, it's a huge responsibility on your shoulders being the founder chairperson. Anything that you have not taken up yet and you would like to address that through the ABIT?
Oh, lots of causes. Uh, to start with, animal welfare is something that I would definitely want to do something in. Sports is another area. I myself am very passionate about sport, and I think it's one of the best ways that one can cope with life.
Sports.
It's very very underrated. Sports, like I said, is one of the best things that you can do for your mental well-being.
Thank you so much, both of you. Thank you for joining in.